let's start with this statement that the former president's office put out. Is there any way that they just found out for the first time on Friday that he had prostate cancer and it had metastasized to the bone with absolutely no warning? Do you find that likely prior to that?
I think it's less likely. I think the better story and the fact is that probably he's had this for many years. We know that about a year ago, his physicians, they basically gave him the clear bill of health that he's in good physical shape and there are no issues. And typically this kind of like prostate cancer, stage 4 prostate cancer, doesn't show up within 1 year. He probably has had it for many years. Given the importance of his job, a consortium of doctors take care of these presidents. I've had multiple presidents in my practice that I've taken care of, and it's not always one doctor. There are multiple doctors. They go through very aggressive screening, PSA, digital rectal exams, and it's very unlikely that he just was diagnosed now and with metastases. Yes, if you're in third world countries where there are no PSA screenings, we see people coming in with PSAs of 100, 150. That's a different story. But in America, with our healthcare system, given his position, it's practically almost impossible to see someone show up with stage 4, Gleason 9, metastasis to bone within a year. That's unheard of. And I certainly, in 25 years of my career, I've never seen it.
You've never seen it?
Correct. These are very aggressive cancers. Typically, if you look at the past 10, 15 years of his PSA, they gradually climb up, even though the PSA is not always the most specific test, but you will see a rise. There would be some symptoms when it comes to these aggressive prostate cancers. Typically, prostate cancer is asymptomatic, but they would have some vague symptoms of urinary issues, getting up in the middle of the night, sometimes even blood in the semen, etc. Obviously, he's 82 years old, and over 50% of men over the age of 80 will have prostate cancer if you diagnose them. The problem with him is that he has a very aggressive Gleason 9. Now, the worst is Gleason 10, so this is up there. And the fact that it has metastasized, either in the first scenario, it was completely missed, which is hard to imagine, or it was not reported at the time of diagnosis many years ago, and they're just reporting the metastases, or this story, I think there are more questions than answers, given what we see today with the type of cancer that he has. It doesn't make sense.
Well, the third possibility is they did see it, and they kept it a secret from us.
That certainly is one possibility, that's for sure. But the timing of this and the fact that it was just released now is very strange and odd. Now, the treatments are obviously very, very difficult. As you know, Megyn, if I would have met him about 10 years ago when this cancer was just localized within prostate cancer, with our technology of robotic surgery, we could have saved his life with possibility of radiation afterwards if he needs it. Now that the cancer is spread to the bone, the prognosis is poor. Now, from the time of diagnosis, whenever that is or that was, it takes about 5 to 7 years for the cancer to metastasize to bone, and another 5 years or so for the person to die, unfortunately, from this disease. Obviously, that's the average. The only treatment that's effective right now is not surgery, it's not radiation, it's hormonal treatment or medical castration, where it can reduce his testosterone to a very low level in order to slow down these cells from growing further. So we can slow down the progression, but there's no cure at this point.
Doc, there was another doctor online who was suggesting that it was possible that some of the treatments for prostate cancer can cause what looks like a decline in mental acuity. There's a Dr. Stephen Quay. He wrote an article for The Spectator, and he said as follows. You tell me whether this is true. He said, was President Biden's cognitive decline a side effect of prostate cancer treatment? ? A recent study showed that 4 objective measures and 1 subjective measure of cognitive function were all significantly impaired by the androgen deprivation therapy, ADT, used for metastatic prostate cancer treatment, citing a clinical trial report. Is that the case? Is there a treatment for prostate cancer that can cause what looks like cognitive decline?
Yes, what he's talking about is something called ADT or medications such as Eligard or Lupron, which I was just talking about, the hormonal treatment. And not only they would lower the testosterone, they can cause hot flashes and menopausal symptoms, but they can also have cardiac issues. And one of those side effects, Megan, is mental health issues, meaning like, it's a little cloudy, it's not, they're not concentrating, and it can affect it. Now, don't forget that President Biden also has had in the past 2 episodes of aneurysm in his brain, has had multiple surgeries on that. So some of those could also affect his mental issues. And if you look at my Twitter about like a couple of years ago, I talked about that as a doctor, I was concerned about his mental health issues. But of course, as a doctor, you don't want to get into politics because media can always come back and attack you for being honest and telling the truth. But given also his age, that he's 82 years old, under a lot of stress, has been in politics for many years, the brain aneurysm, 2 episodes, and sometimes even prostate cancer can, of course, it always metastasizes to bone, but it can also metastasize to brain. It's not as likely, but all of those are scenarios and the side effects of hormonal treatment that can cause mental health issues.
Let me ask you something, Doc. As you and I have had discussions like this for many years now, and you're right. I agree with you. Had they come to you 10 years ago with an initial diagnosis, you would have used your robotics, arm to perform this incredible surgery. You were one of the first to do it. And is that a point on the other side? Like that this is truthful, that they did just discover it? Because if you are treating, because everybody's thinking the same thing, that they found out and they kept it quiet. They didn't want us to know because they wanted to beat the orange man. And they knew saying the sitting president has cancer would not be a great reelection tagline. So, but to argue it on his side, let's just walk it through. Because if they did have a high PSA test while he was in office, or even before he became president, right? 5 to 7 years, you say, so that would have been before he became president. Wouldn't they, politics aside, have gone to a Dr. Samadi type and said, let's have a surgery? I mean, is it plausible that in the name of staying in office or getting in office, he would not have had the prostate surgery just to keep it all on the down low?
Yeah, I think it's an excellent question that you're bringing up, Megan. And in my career of 25 years, I have dealt with a lot of politicians and TV moguls who have come up with prostate cancer. And unfortunately, sometimes they make a wrong medical decision based on political reasons. And this is what the point that you're bringing up is that maybe at the time, we would have had a perfect cure and put this to rest. And instead of what was going on at the time with politics and the fact that it can affect his campaign, not only him, but many other politicians that we've seen in the past, they may have made the wrong decisions. Now, I cannot be sure of that because I'm not his doctor. I haven't looked at his records, but one thing is clear is that it's very hard to wake up within a year and go from 0 to stage 4 prostate cancer with metastases. Now, what they're saying is that the doctors felt a nodule. What's a nodule? It's a firmness on the prostate. 15% of prostate cancers are detected by a nodule or firmness on the prostate itself. 85% are detected by the blood test called PSA. In today's world, if there was any question about his PSA or what we call PSA velocity or the rise of that blood test, there would be MRI all over him. There would be PET scans. It's very hard to imagine that the president of the United States will go on for years without the kind of attention that normal patients will get in our practice, and this was missed. So I have a very difficult time to believe that. Whether or not they made the wrong decision because of what the politics was, that certainly is a good question that you're bringing up.
What if, let's just say he got a diagnosis 5 to 7 years ago that he had prostate cancer, and we have no idea what's true. They've lied to us so many times about his health. We really don't know what to believe. But I mean, for all we know, he did have some sort of a surgery and this is a recurrence. We have no idea. But is there a way, if they said, can he get treatment while the sitting president, with medicines over the past 4 years? Could he have done like this ADT or the thing that we just discussed? Could he have been taking those treatments over the past 4 years, like quietly on the weekends? How would that go?
Well, we know that he has not had surgery because if the information they're telling us that it was just last week that they examined him and they felt a nodule, that means that the prostate is still there and nobody has removed it. And so if he had been diagnosed with prostate cancer while he was a president, they could have treated him with this hormonal treatment, given the fact that he had metastases. But he would be, even though we didn't see a lot of him on TV and he was not present for a long period of time, but you would see him at times, he would break into sweat and he would have exactly like menopausal symptoms that women go through, that he would get hot flashes, that he would be very tired, and he would have a lot of symptoms and side effects of this hormonal treatment. So the story doesn't make sense. I think that certainly he's had this cancer for close to a decade or so. Prostate cancer, Gleason 9, it grows rapidly, but it takes years for it to metastasize. And I don't see too many patients like this, not in today's world with the kind of screening, the MRIs and exams that we have. And if that's truly what happened, it's a major, major malpractice.
This July, speaking of resets, there's a global summit of BRICS nations in Rio. This bloc of emerging superpowers, including China, Russia, India, and Iran, are meeting with the goal of displacing the U.S. dollar as the global currency. They're calling this the Rio Reset. As BRICS nations push forward with their plans, some worry global demand for U.S. dollars will decrease, bringing down the value of dollars in your savings. While this transition will not happen overnight, the Rio Reset could mark a pivotal moment. So learn if diversifying your savings into gold is right for you. Birch Gold Group can help you move your hard-earned savings into a tax-sheltered IRA in precious metals. Claim your free info kit on gold by texting MK to the number 989898. With an A-plus rating with the Better Business Bureau and tens of thousands of happy customers, let Birch Gold arm you with a free, no-obligation info kit on owning gold before July and the Rio Reset. Text MK to 989898 today. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.